So good morning and welcome to this COVIDx Open Call number 2 webinar. Today we will talk about clinical partners and datasets. So we'll give you a brief description of the single solutions and the clinical partners that are part of the consortium. So my name is Giulio Pagliari, and today together with me and with my colleagues, we would like to give you a warm welcome, and we would like to thank you for attending this event and for your interest in the COVIDx program. So just few, let's say, rules or indications in how to interact with us. So in case you have any kind of question or any kind of doubt, you can put your question in the question and answer button using the question and answer button you see in the lower bar. Otherwise, if you have any comment, you can write it in the chat box. And if you want to directly ask a question, you can just raise your hand, and then in the question and answer session, we'll give you the floor. So thank you again for attending this event. Your camera and your microphone will be switched off, and we can start. So I think I have some troubles in it. Okay. So today's agenda is this one. So actually, I will give you a brief introduction to the COVIDx Open Call number 2 single solutions. So what we mean for single solutions and what we can offer you. Then we'll give you some details regarding each of the clinical partners that are involved in this project. So the Karolinska Institutet, Servizio di Regno di Salud, and Humanitas Research Hospital. And as I said before, we will have some time for question and answers. So regarding the COVIDx single solutions, if you are a small, medium enterprise or a startup and you have a solution, so actually a product or something with a technology readiness level that is over 7, then, and it is of course related to COVID, then you could be interested in this program. So of course we can offer you funding. So as you can see, 100,000 euros. And additionally, we can offer you some mentoring activities as well as other services. So if you're interested as a single player, you can also ask us for a clinical partner between the Hospital Clínico San Carlos, so actually SMEs, the Instituto Clínico Humanitas, so Humanitas Research Hospital, and the Karolinska Institutet. So if your solution meets the general requirements of the COVIDx program, and additionally is in one of these challenges, so if you see yourself in one of these challenges, well, then you can apply for the program and also give us some details regarding your preferred clinical partner. As you can see, we plan to fund about 7 startups, so actually 7 single solutions. And depending on the challenge, the clinical partners will have interest in working together with startups or SMEs. So as I said before, other than funding, you will have access to the full acceleration program, as well as the COVIDx Data Sandbox. And please remember that the deadline for sending your application is the 22nd of July. So if you plan to send us your application, please start doing it in the next few days so that we know that you already opened an application and we can give you some support in case you need it. So we can now start with the clinical partners. The first one is Karolinska Institutet. So I'll give the floor to Socrates.
Thank you, Giulio. And thank you everyone for participating in this webinar. My name is Socrates Nifakos, and I am a PhD candidate at the Karolinska Institutet at the Department of Learning, Informatics, Management and Ethics. And I will try to present you our entity and what we are aiming with our participation in the COVIDx program. So a few words about our university. Here you can see our president, the previous president of the University of Oslo, and now currently president at Karolinska Institute, Ole Petter Ottersen. Kea is one of the world's leading medical universities. And as a university, is Sweden's single largest center of medical academic research and offers the country's widest range of medical courses and programs. Here you can see the KI numbers based on the annual report of 2020. There are 6,560 full-time equivalent students, 2,039 doctoral students, and 327 professors. As you might probably know, of a Nobel Prize that was established by Alfred Nobel in his will of 1895 and was first awarded in 1901. Karolinska Institute is responsible for the Nobel Prize in Physiology or Medicine. We, as a university, strongly support the equal opportunities. Equal rights and opportunities for all means that no one should be discriminated against or harassed because of gender, transgender identity or expression, ethnicity, religion or any other belief, disability, sexual orientation or age, etc. So it's important to highlight also this, that we are very much provide an inclusive work and study environment in which all students and co-workers are treated with respect. Here you can see in this map, based on the international co-publications of 2017 to 2019, our strong collaboration with institutes all around the world. So the number of academic articles published by KI researchers in collaboration with one or more researchers from different parts of the world. Some financial information. The annual revenue based on the 2020 report was 7.3 billion Swedish kronor, which means in euros approximately 700 million. And here in this pie chart, you can see the different sources where this revenue coming from. Also, here you can see the external research funding and where we get funded from different private and international organizations. And here is the EU contribution. Currently, we run 201 EU financed projects. One of them is COVID-X, and 37 ERC projects, European Research Council projects. Here you can see the structure of our university with different roles and the different departments. As I mentioned before, I belong to the Department of Learning Informatics, Management and Ethics, which is a department that belongs to the campus in the north side of the university. And here you see the organizational structure when it comes to different roles. And this is the geographic location. So Karolinska Institute is a university with 2 campuses and collaboration throughout the healthcare system in the Stockholm region, meaning that we have strong collaboration with all the hospitals in the Stockholm region, conducting studies together. So from the researchers' perspective, we are the research institute and we have the real field. We have many hospitals that we're conducting research together. We have also a research center in Hong Kong, focusing on reparative medicine. Since 2017, we have significantly expanded with new laboratories and offices. We have a number of service laboratories, competency centers, and equipment within the areas of imaging, biostatistics, biobanking, proteomics, and genomics. And we have a joint organization for animal research. Here you can see the international ranking based on two different sources. So according to the different disciplines, we have been ranked 9th in the clinical medicine in Europe, and based on the Times Higher Education, and we got ranked in the 5th position. As I said before, KIA is one of the world's leading medical universities. A few words about our involvement in the COVID program. We are participating with a program with a clinical history taking system that we have developed within our university. We are targeting different challenges based on the physicians' inputs, overwhelmed by cognitive demand and limited time to interact with patients. CLIOS is a high throughput method for standardized collection for clinical phenotype. It's acting independently of the professional time, and also it's functioning across time, which means that in the clinical pathway, the system is acting from the beginning, from the admission till the end, to the follow-up and recovery. Moreover, the databases that we are collecting this data are subject to sophisticated mathematical analysis, which means that we can provide data for feeding different models and different algorithms for decision-making, decision support, diagnostic procedures, etc. This is the core of the system, a formalized medical knowledge, and it's interacting with patients. It's also integrating data from different sources, omics, laboratories, physician interviews, and it's a standardized database on behavior of disease, and the data are exactly comparable for patients because of the standardized way that they are structured. And this is all from my side. I think for COE, it's really important that applicants targeting the challenges that we have defined in the COVID-X program, we're looking for prospective analysis, which means that we are trying to enhance the current data collection processes that we have. So we're looking for solutions that they are very much targeting in data collection. So we're not, as an entity, providing any data as the other two clinical partners in the consortium, but we are looking for entities that they can help us to enhance the data collection process for COVID patients. That's all from me. Thank you so much.
So thank you, Socrates. I will share now my screen, so you should be able to see again my presentation. And Henar, the floor is yours. So I will just give you an introduction to the Servizio Madrileño de Salud and the Hospital Clínico San Carlos.
Okay, so hello everyone, I'm Henar González, and I'm going to introduce SERMAS and what we can provide to COVID-X SMEs. So please, next slide. SERMAS stands for Servizio Madrileño de Salud and is the administrative structure that gathers all public health services, hospital and primary care in the region of Madrid, Spain. We are a reference center at national and international level for our facilities and professionals. We are more than 5,000 employees. We have almost 1,000 beds, 4,000 hospital admissions per year, And we are with two universities, Universidad Politécnica de Madrid and Universidad Complutense de Madrid, a whole research institute. Please, next slide. So inside SERMAS, we are Hospital Clínico San Carlos, and inside the hospital, the department that is involved in COVID-X is the innovation unit. The mission of the innovation unit was to create a bridge between the innovators inside the hospital and the outside ecosystem, technological companies, pharma companies, universities, and so on. So we try to transform the new ideas generated outside to new clinical processes and products inside our hospital. And right now we are focusing all projects related with data to trying to foster innovation to our patients and our professionals. So all the projects that we are participating in right now can fit in this stream you can see here. So we are enhancing data collection, process mining, data visualization, and all with the purpose of having a proper data warehouse that we can use for research applications related with artificial intelligence, decision support systems, and so on. We are participating in a project inside the hospital and also at national and international level as COVID-X. Please, next one. We are mainly participating in these challenges, the number 2 and 3. So if you are interested in them, we are able to provide information and data set to 3 SMEs. Please, next one. So Hospital Clínico San Carlos has a data warehouse that is called BedeClin, and that gather clinical and non-clinical information from our patient. The data that could be provided could be from COVID period and would be fully anonymized. You would also have access to a code book where we have defined all the variables, and they are mainly distributed in the administrative part that have demographic data, diagnosis codified in ICD-10, procedures, stays, and the activity from our emergency rooms. And you will also access clinical information related with symptoms, medication, lab work, the PCR result codified in positive or negative, and also some data related with the patient admitted to the critical care rooms. Please, next one. This is a small diagram of how be the process for obtaining the dataset. If you apply and prefer our hospital and we are in March, we'll have bilateral meetings between the hospital and the SMEs, so we can understand your needs of information for your research question and to test your solution. Once we have this, we'll have to make a joint protocol that must be approved by our ethical committee, and this will take approximately 1 or 2 months. And after that, we can proceed with the dataset extraction, and when it is fully anonymized, we'll upload it to the samples so you can access. And this is all from my side. Thank you.
Thank you, Enar. So we can now move on to Humanitas Research Hospital, and Alessandro Carlucci will give you some details and an introduction to Humanitas. So Alessandro, the floor is yours. The floor is yours. Sorry.
Yes, thank you, Julio, and thank you everybody for participating here. I hope you can hear me properly. I guess yes. I'm Alessandro Carlucci. As Giulia was mentioning, I work at Humanitas Research Hospital as operations manager for the AI Center. And today I'm speaking on behalf of Humanitas, and I'll try to give you sort of an overview of the hospital and which are our challenges for the COVID-X program as well, and then which would be our request for potential collaboration with the SMEs. And we will probably have some times also for the description of the dataset that could be part of the program. And as Julia was mentioning before, if you have any question or doubt, please consider to click the Q&A button on the bar or use the chat as you prefer. So if we move to the next slide, Humanitas Research Hospital is a highly specialized teaching and research hospital. And as you can see from the figure also, Humanitas is part of a larger healthcare group. And the group includes several hospitals located in Italy, as well as some local medical centers called Humanitas Medical Care. Humanitas also combines specialized centers for the treatment of cancers, as well as an immunocenter, neurological and orthopedic disorders, and a fertility center and ophthalmology center, as you can read. And also Humanitas is home for Humanitas University, which is strictly linked and bound with the hospital and offers courses in medicine, medtech, as well as nursing and physiotherapy, with a strong commitment in clinical research, as well as medical treatment improvement. So to give you an overview, we just reported some numbers. And as you can see, we treat more than 1 million patients per year with more than 2,200 physicians. And if we move to the next slide, as we were saying, Humanitas is located near Milan, in Milan area, which is a place in Lombardy where the outbreak of COVID has been severe since the first days. So since the outbreak, Humanitas has been directly involved in the battle versus the pandemic, treating more nowadays like more than 4,000 patients and supporting the institutions in the fight with the dedicated COVID-ER that was inaugurated 1 year ago in July 2020. And moreover, as an healthcare provider, Humanitas also is serving as a vaccination center. And currently we delivered about 230,000 vaccine doses to the population. Considering this framework, we are now interested in finding solutions that can help healthcare professionals in performing fast and accurate analysis among the clinical data that are available in ER, diagnostic, imaging, historical data, and whatever, in order to gain the ability to detect, classify, and treat the infected patients as early as possible. And in this case, it's mostly to reduce the burden on the public healthcare system. So please, the next slide. And as I was mentioning, nowadays, like major hospitals are moving towards digital healthcare, and also the solutions that probably will come into this program will involve digital applications. In this regards, I wanted just to spend a couple of words about the Humanitas AI Center. Humanitas is also housed of an artificial intelligence center. And so the focus here is more on the data, the importance of the data in modern healthcare, in order to propose and design solutions that are crucial to properly treat the data, analyze them, and be able to share it according to relevant guidelines and regulations, especially here in Europe. And since the program is organizing an European framework, which allows different players coming from different countries to collaborate on same data, it will be crucial to actually have the right pipelines to process this kind of data. For example, we will provide an automatic custom anonymization pipeline, and all the data that will be treated during the program will be totally anonymized and ready to use. As a last point on this, I would also add a little last minute new. Humanitas has appeared in June 2021, so just this month, on the Newsweek board of the best digital hospitals, ranking at position 34 in the world and first in Italy as a best digital hospitals in the world. Regarding the challenges, as Julia was mentioning before, we were interested in challenge 2 and 3. As for Hospital Clínico San Carlos, and they are respectively related to innovative diagnostics and personalized care. If we move to the next slide, we can see a little bit of details on those two COVID challenges. You can find also all the documentation about this and all the details. If you have any kind of question, we can move towards the end of the presentation for the answers. And so again, if we move to the next slide, we can see that our main requests for those two challenges is to have first, I mean, we are looking for solutions that are TRL 7+, and we mean that so we are close to a CE marking or already have a CE marking. So we have like high-level solutions in a market readiness team. And we also are looking for SME startups, and we are mostly interested into data-driven solution, which fits the description of one of the challenges listed before. And also, we are quite interested in AI-based solution for both the challenges, since, as I mentioned before, we are quite interested in digital diagnostics and digital innovation. So since we can provide both a clinical expertise and also a data science expertise through our AI center, we would like to spend our energies and our effort in developing innovative solutions based mostly on AI. So if we move to the next slide, please. Yes, as mentioned before, we will provide data set from patients treated in our hospital since March 2020, so since 1 year and a half. Currently, we are able to provide you 90+ features. So among like CT scans, imaging, metadata, and clinical data coming from clinical records, ICU, and emergency room, and also laboratory data, we achieve almost like 4,500 patients with more than 90 features per each one. All the data will be provided through the COVIDX sandbox, and it's all already developed in cloud. So all the access to the data will be provided through the platform, and will be easy to gain access to whatever kind of data set you will need. Just point out another thing regarding the anonymization. It really depends on the kind of data that we are going to provide. We are not excluding any kind of longitudinal study, but at the moment, it's just enough to know that all the data will be anonymized and ready to be used. So if you're interested into our kind of data set, if you're interested on CT scan and imaging kind of innovative diagnostics, please just ask for whatever kind of doubt or interest you would have in Humanitas Research Hospital. And we are looking forward to collaborate with you. And thank you for your attention. I guess that it's all, and we can move to the Q&A session. Yes, okay, thank you guys.
So thank you, Alessandro. So we are actually running on time, and we have now about half an hour to your questions and your comments. So I will check the chat box.
Inigo already has the microphone.
Okay, so are you going to ask directly a question, or?
Yes, Inigo, you have the microphone open, so if you could ask your question live, it would be brilliant. So, Giulio, maybe you can read the question. And
yes, sure. So actually the question is for NR. So the data you are offering is shared through the sandbox, or will we need to integrate our solution with your services directly? So I think you already answered this question, but if you want to give some other details, please.
Yes, I think I have I have it right on the chat. We are in COVIDX, our role is data providers, so we are expecting to give the dataset through the sandbox. This is our role. We are not expecting to integrate with any proprietary solution or nothing related.
Okay, thank you. So the other question was regarding the email. So actually, I see that you have already answered the email. So Alessandro, they're asking for your email
yes,
too.
I will text into the chat so it's easy for everybody to see it and also gain it.
Okay, thank you, Alessandro. So the next question is again from Inigo. So he says that the resolution needs to download all the data, and the AI algorithm will do the most, but users, such as clinical researchers and the consensus must interact with the AI. Is that fitting your expectation?
If it's for me, I don't think so. The access to a clinical professional directly is going to be limited, really limited. For COVIDX, what we are doing with the SMEs from the first open call is try to do a first trial with the data. So of course it's retrospective. And once we have result, if our professionals are happy with them, we can maybe explore further collaboration outside COVIDX. But in the project, we are not expecting that much the clinical feedback because the department involved is the innovation unit. We have some clinician, but maybe not from the specific department that you need. So the clinical involvement is, we cannot guarantee.
And maybe I can add something regarding the sandbox. So right now the sandbox is used for, let's say, sharing data. I mean, for accessing data and for example, training or some other, let's say, activities that you can perform. In many cases, the partners are using the sandbox for exploiting these actions. So probably this is a question that is both relative to related to the let's say clinical part, but also to the technical part. In general, in some cases, data cannot leave the premises of the hospitals. So this is something you can, of course, ask. So if you want further details regarding this, maybe you can ask for a direct question, or if you want to have any, let's say, explanation on that, you can just ask, and we'll try to give you further explanation even offline. But thank you for your question. So while we're waiting for some other questions, is there anyone that would like to comment, or do you want to add anything else on your presentation?
So everyone, all the participants have the microphone open, so feel free to speak out and ask questions if you have some.
So maybe, Antonio, in the meanwhile, we can just say a few words regarding the, let's say, the application process and the evaluation. I think that you already, let's say, touched this topic during the first webinar, but in the meanwhile, maybe we can just...
Inigo raised the hand, so please.
Okay, great.
Hi, I'm not Inigo, I am Mabel. I'm here with Inigo attending this meeting, this webinar. And well, one of our questions is the solution we will provide requires clinicians from the hospitals involved to use the platform or the solution we will provide. Is it possible? I don't know if it, okay, maybe you want me to clarify a little bit better, but okay, we are providing or we are proposing a solution to empower clinicians to do better diagnostics and researchers as well. So this will require not only accessing the data in the sandbox, but as well clinicians in the hospital, imagine in San Carlos or Humanitas, using the platform. Is it possible? It's something that could be considered.
I would just say a couple of things. Hello, it's Alessandro speaking from Humanitas. As soon as the solution is not used for clinical real, I would say for clinical purposes. So since first of all, is the solution CE marked, or this platform is already CE marked, or you are waiting for an approval for CE? I don't know, just to understand the level of
okay.
readiness.
Okay, first of all, our platform doesn't require CE marking because it focuses on research, diagnostic research. So as far as we have studied and assessed the law regarding the medical devices and so on, we don't, well, it's not required for us a CE marking.
Okay, I just asked you because if it impacts in some way the clinical path of the patient or any clinical reasoning of the clinician, in this regard, it would be hard to be used before SE approval or an internal ethical committee approval. This doesn't mean that it's not usable, but we need to assess. I mean, we need to understand a little bit more about the solution, the proposed solution, I mean, from my point of view, to answer you properly, because I cannot exclude that physicians or researchers would be using the platform for the scope and then testing it, so validating it in the real way. But I can't ensure that this will be possible because it really depends on what the platform does and how it, which kind of effort requires from the clinicians as well.
Well, yes, I understand. This is an AI that is focused on research. So it's not like, imagine the clinicians using our platform, providing directly, how to say, diagnostics to patients. It's more like for researchers, for researching purposes, to discover the reason or the origin of the etiology, in this case for the COVID-X. But in any case, I understand that it's necessary to, well, go or get into the details of what is possible to be done or not with our platform, so that if it could be used or not by the clinicians. But I get it. So thank you in any case.
Okay, if I may comment briefly from the technical viewpoint, of course, with respect to the clinical viewpoint, it's what Alessandro and our clinical partners have replied on. But from the technical viewpoint, I understand that your end users are the clinicians or the doctors to help them make decisions with respect to what is the case by providing them the results of your AI solution, correct?
Well, yes, somehow the AI will support the clinicians in their research, and it's like inputs made by the clinicians into the AI, and at the same time the AI providing outputs to the clinicians. But it's not like you have a patient with you in the room and you say, okay, my platform, my AI is saying that you are, I don't know, a long COVID. It's more like a way to support clinicians in well, provide, how to explain it, hypothesis to be validated by clinicians in the diagnostic research. It's not
okay, so you don't have need of actual hospital data or patient data.
yes, we need the data as well, but what the AI does is precisely work with that data lake and extract intelligence from there, so that to support and empower the clinicians to do better diagnostic research. Because at the moment we know that one of the main issues they have, clinicians and doctors in general and healthcare professionals, is precisely the the data load. They are overloaded with data, and it's not possible to provide precision medicine without processing the data that is already there. So that's where our AI is helping them.
Okay, with respect to your question, if it can be used, etc. Of course, the clinical partners will have to reply whether they can accommodate clinicians that can be involved in validating your technology.
Mm-hmm.
But from a technical viewpoint, it is doable because then you will be accessing the data that you need through the sandbox, and you can be using also the dashboard services if you want, and this can be used by the clinicians that could be provided by clinical partners. But I leave this answer to our clinical partners, of course.
Well, I think Alessandro explained it very well to me.
Do you mind if I jump in here and give you a... So I will share with you the technical annex. Okay, I guess you can see it now. So we actually have 2 pages on the technical annex where you should provide this information. So we allocated in total, if you have not seen it, the annex file or we request only 10 pages. Okay, but for this one we are allocating 2 pages. One for you to describe the scope of your solution, so the intended use and all those questions that you were raising and that Alessandro asked you about how the software will be used and so on. You should put them here on the intended use of your software. And based on this and on the supporting documents provided by the Commission, state why you claim that your software is not a software medical device. So be really clear about this. Okay. And then in the following page, so we have 1 page for this. So our advice is be as clear as possible in these 2 in these 2 questions. And then in relation with the TRL and CE marking, if you are so go to our guideline for applicants where we describe what we understand by TRL, the different levels, and clearly state why you think you are at a specific TRL that you will say, whatever it is. And if you are in the scope of a medical device, you will need to have a quality management system. Okay. So if you are not, it's good for us to know that you do have a quality management system. But if you are a medical device, just to state here what is some of the key components of your quality management system, because the regulation does not require the quality management system to be certified, but it requires that it is working properly with the characteristics or with the constraints defined in the regulation. Okay, so again, two answers here. If you are a medical device, you need to state the status of your quality management procedures. And again, if you are a software medical device, just state here what is the status of the CEU marking for your product. Okay.
Thank you.
Hope this helps everyone.
Thank you, Antonio. I'll get back to the slide. So another thing that probably should be highlighted at this point is that in some cases, retrospective or prospective studies, let's say, could be available depending on the partner. So I guess mainly retrospective studies in this case. So Alessandro and Socrates, can you just stress a bit more this part, so regarding the potential retrospective or prospective study?
Yeah, as I mentioned in my presentation, this is something that we are offering in our pilot. Let's say that we have the system that we are collecting data. We are not providing the current collected data, but we are trying to improve our data collection procedures. This is what we were asking from the partners in the first round, and we are collaborating with one group now that is really helping us to improve this data collection, and we would like to expand it even more. So, for example, some solutions that could address this challenge that we have in our use cases, for example, solutions with chatbots, solutions that they can improve the diagnostic procedure when it comes to the patient interview, conversational agents, other processes that we can have in how we visualize information to the patients, what kind of data collection we can have remotely without someone to be admitted in the hospital. So these kind of solutions, these kind of projects we can accept in our case. This is the difference between the retrospective procedure and the prospective that the other two clinical partners have. They have already data and they're using this data for data analytics processes.
So thank you, Socrates. Do you want to add anything, Enar or Alessandro?
Yeah, I wanted just to point out one last thing about this. Thank you, Giulio. Thank you, Socrates. One interesting point is that with retrospective data, we can also, in a certain way, simulate how an hospital behaves in certain kind of with certain kind of patients. So what I want to say is that for some kind of solutions, which needs a large amount of data to be validated, but it would take too much time to perform a prospective study, we can also try to set up a simulation of reality in which we use partial retrospective data, and then we have already the outcomes because the patient already traveled in our hospital and had the entire path. So we know the outcome, but we can use the first part of the data, so the old one, as an input for your models, for example, and then knowing the output because the thing already happened, we can evaluate and assess the performances of the model without actually needing any kind of prospective study that would take longer times, and let's say it would be harder to fit in the time constraints that we have for the program.
So thank you, Alessandro. And on that,
for hospital clinical trials is the same as Alessandro has said. For us, we are expecting retrospective studies because doing prospective and involving patient would make to need further approval for our ethical committee. Maybe it's not a clinical trial, but the type of study is going to be more difficult to get the approval. So in our case, we are expecting retrospective as well.
Thank you, Tuna. So just to add something here, yes, of course, each of the, let's say, study you'd like to do within the program would pass through ethical committee. So actually it would be the local ethical committee of each partner in case it's needed. But for example, for Italy and for Spain, it is needed, and I guess also in Sweden. So actually for Karolinska Institute, but maybe Socrates can give us further indications regarding the ethical approval process. And regarding the timeline, let's say, yes, the acceleration program will last about 9 months. So it will be divided into three sprints. And there will be also an onboarding phase in which we will try to assess the first thing. So yes, please, Socrates, thank you.
We have a dedicated deliverable task in COVIDX program responsible for the ethical and legal monitoring. And we are evaluating there the time plan for the ethical approval when it comes to single solutions and double solutions. So for us, for example, in Sweden, we have approximately 6 weeks after the submission of an ethical application to get notification from the ethical board. More or less, I think, Alessandro, or is it the same for you? So I think the plan is, the time plan is more or less the same. So it's 1 month and a half or something for the solutions that we have, the pilots we have within COVIDX. When it comes to the solutions that they bring in a hospital, this is another process that we follow. So we need to evaluate the ethical procedure when it comes to, maybe some of them they have already an ethical approval, or some of them they have to describe in the work plan when they will submit the proposal how much time they will need in order to get this ethical approval based on the regulations they have in the different in their countries. So this is something I think the applicants should be aware of and consider when it comes to the description of the work plan, how much time they would need in order to get this ethical approval and be prepared to submit the corresponding documents. This is my input in this ethical and legal monitoring task.
So thank you, Socrates. Yes, and during sprint 1, so actually the idea is to prepare a research protocol together with your clinical partner. So in case you are selected and you will work with one of the clinical partners of the consortium, you will prepare with them this research protocol and then send it to the local ethical committee. So I don't know, we still have some minutes. If you have some other questions, comments, you'd like to ask us anything else. So once again, use please the chat box, the question and answer section, or additionally raise your hand. Otherwise, in the meanwhile, I don't know if there's anyone else from the consortium in this call that would like to jump in and comment a few things.
Okay, just one comment. We will have a general webinar in the beginning of July, but we are considering the chance of organizing general webinars. So please follow us on HCSC, social media, website, and you will be invited to the additional webinars if we have them.
So thank you, Antonio. In the meanwhile, so we can just give a short reminder regarding the deadline. So actually the deadline for the application is the 22nd of July, as I said before. The evaluation in this case will be a 2-stage evaluation. So our first step will be, let's say, after the first deadline, and then we will get back to you with our first answer. And Antonio, can you just give us a brief description of the second stage, if you want to?
So we will make the evaluations of the first phase until the beginning of August 6th, and we will invite the teams that move to the following stage, for them to start the second stage application for the second call from August 7 until 16 of September, if I'm not mistaken. So we plan to fund 7 solutions on each scope, so 7 single solutions and 7 team solutions. And we will invite 3 times the number of participants to move to the second stage. And in the second stage, we will have a remote evaluation procedure, and we will invite 14 teams of each type to go to an online interview where we make the final decision on who we will fund. So in a nutshell, 21 teams will be invited from each scope to move to the second stage, and then 14 will reach to the final stage. This may change because of the quality of the solution. So you have low, very low, or very high quality. These numbers may be adapted. Our priority is to help as much good solutions as possible. Okay. Hope this helps everyone.
So thank you. I think this will clarify, of course, the selection procedure. Okay, so I think there are no more questions. We can wait a few seconds and see whether there's something else we can address. So in the meanwhile, I'd like to thank you once again for attending this webinar, for your interest. I hope we will receive your application in the next few days, and hopefully, of course, within the deadline. So if you have one of these social networks, please follow our web pages. So actually on LinkedIn, Facebook, or Twitter. And of course, there will be also some other pages related to each clinical partner or each of the members of the consortium. And well, thank you again for your interest, and I hope to see you soon.
Thank you all for attending. Thank you, Julio, and all the panelists for making this happen.
Thank you, Julio. Thank you.
Thank you. Thank you, everybody.
Thank you, everybody.
Thank you. Bye-bye.
Thank you. Bye.
Thank you.